So this is the final video in the UTI case series, and we will be today talking about prevention. But before talking about prevention, I have to talk about two important terms. That one is recurrent UTI and other one is frequent recurrent UTI, because we will need them in some guidelines. So recurrent UTI is two or more than two upper UTIs, such as pyelonephritis. While the second definition is one upper UTI with one or more than one lower UTIs, and the third definition is more than three or more than three lower urinary tract infections. So any of it, you can call it recurrent UTI. And there is another term which is called frequently recurrent UTI or frequent recurrent UTI, which means 3 febrile UTI in 6 months or a total of 4 UTIs in 1 year. So when we talk about prevention, we always faced to antibiotic prophylaxis. So what will be the role of antibiotic prophylaxis in prevention? So if we classify such patients with recurrent UTIs or UTIs in which we want to prevent the UTI infection. So most of the authority do not recommend antibiotic for after first UTI. And one of the important study that I have to talk about is the RIVUR, but before that, so as I said, not routinely recommended, but there is a recommendation in non-VUR patient, the patient who have no evidence of executory reflex and they have frequent recurrent UTI, then there is an indication, yes, you can prescribe prophylaxis. And the patient with VUR, there are 3 to 4 things that has to be present to actually prescribe prophylactic antibiotic. That is high grade VUR. So high grade, by that means 3 or 4 grades. If there is documented UTI, irrespective of the severity, and similarly in non-toilet trained children also, irrespective of severity, we advise in antibiotic prophylaxis. And the fourth one is the bladder bowel dysfunction, and we will talk about bladder bowel dysfunction in a minute. But in this is randomized intervention in children with vesicular tract reflux children. This was a trial, and it showed that yes, there is a 50% reduction in UTIs with children with VUR if we advise antibiotics, but there was no effect on scarring. So this study is kind of that if there is no benefit, then usually it's not recommended. So which is one of the study that shows that yes, it definitely decreased the UTI, but scarring and end-stage renal disease prevalence is not affected. Okay, so if we use antibiotic for prophylaxis, what will be the choice? That is trimethoprim and trimethoprim and neutrofurantoin. Second line drug amoxicillin and cephalexin could be used. Duration is 3 to 6 months, and if during this period there is no UTI, then you have to stop the prophylaxis. If there is a UTI, you have to restart, and you have to also look for the resistance parameters. If any resistance to any of the first line drug or second line drug, then you will be changing the choice of antibiotic prophylaxis. Talking about bladder bowel dysfunction is very important in recurrent UTI, and actually it is a constellation of two things. It's some of the lower urinary tract signs, which is called LUTS or LUTS, and there is some problem with fecal elimination, which is upfront manifested is constipation plus or minus enteroparesis. So lower urinary tract signs usually include dysuria, urgency, frequency, incontinence, dribbling, straining with urination, or enuresis. So if these signs, so they need to be investigated, and for constipation you can use the Rome 3 criteria, and you can in this, so if there is constipation needed to be treated vigorously in order to there are a lot of reason for bladder bowel dysfunction, but talking about one of the things is constipation. So it is a very obvious reason for bladder bowel dysfunction, so it needs to be treated. One complication of the antibiotic prophylaxis is resistance, so you need to keep it in mind. If you see the American Antibiotic guidelines, so yes, they say that yes, antibiotic prophylaxis could be helpful in vesicular reflux, or if there is an underlying bladder condition such as neuropathic bladder or structural anomalies. So that could be a help, but there is overall there is a advice against the UTI prophylaxis with antibiotics. The oral complication of UTI may be causing renal scarring and end-stage renal disease, RC or F, chronic renal failure. So this could be the long-term causes. Thank you. This is the last video of the UTI series. Thank you. Abdullah.